Madam Guy, you mentioned that you'd like to see more results for federal social transfers, and I'm interested in your proposals on this. What is the best way to measure the results that we get for the billions of dollars in social transfers provinces receive?
Well, thank you very much for the question. I just wanted to address how you phrased it. You said more results. Of course, we would like more results for more money, but we first would just like to see where the money is being spent. Right. I think the main crux of the issue is the fact that, and this always surprises people when I say it, but that the Canada Social Transfer gets put into general revenue. It could be used for potholes. We don't know. So the first step is knowing how it's used. Then we can get to outcomes. I will say on the outcome side, there's some really interesting work being done around social return on investment, but a lot of it comes down to addressing poverty and fundamentally addressing the social determinants of health.
Okay. Do you believe in pay-for-performance type approaches to social spending?
Our organization actually did release a position paper in 2014 against specifically social impact bonds. Okay. Knowing that's one type of pay-for-performance model that's used in social financing. So we think that there are some issues with it. We think that there are also issues to mitigate those problems, and that there's not a blanket answer when it comes to this kind of funding, because every application that it's used for is going to be so diverse as the populations that it's meant to serve.
And your organization has, in the past, raised concerns about high marginal effective tax rates on lower income people, a concern which I share, and which I tried to address in my private member's bill. Do you have any suggestions for this committee on how to reduce those marginal effective tax rates on people who are trying to leave social assistance and enter the workforce?
Yeah, and we were supportive of your private member's bill. We are very concerned with clawbacks. That's basically the issue. That, if you could say it in the most simple way, it's that if people are working more and harder, they should be rewarded for that, and they shouldn't be seeing their assistance clawed back. That's really my. Do you have anything to add to that, Fred? No. Thank you for the questions.
Yeah, and you for your answers. For the Medical Association, have any of your members been affected by federal